Hello, everyone. Welcome to today's webinar, Analyzing AEP Insights, Key Trends for Shaping Health Plans in 2025. We're excited to have you join us as we deep dive into the emerging trends shaping the future of health plans and explore strategies for the next enrollment season. We'll get started in just a few minutes, give everyone a couple minutes to join here. Going to give everybody a couple more seconds to join, and then we'll get started. All right, we're going to get started here. Just a couple housekeeping items before we dive into the presentation. The chat is off. Please use the Q&A feature to submit any questions you have during the presentation, and then we'll be following up with the recording of the webinar sometime this week to all attendees. So thanks for joining, and we'll get started here. First of all, hi everyone. I'm Jens Lilhai, Senior Director of Analytics Products at Unite Us. Our team is focused on leveraging advanced analytics to drive outcomes for our customers. And in today's webinar, we're going to focus on how our Insights Growth product can optimize member acquisition and retention in today's marketing. And I'll be passing it over to Ali to introduce himself.
Hello, everyone. Ali Yusuf, Principal Product Analyst, working very closely with Jens here. So really excited to be diving into some of the insights that we found and sharing it with the group. So really excited.
All right, if we can go to the next slide. Before we dive into our Insights Growth presentation, we do just want to briefly introduce Unite Us. We're your trusted partner in transforming social care. We have over a decade of proven expertise delivering seamless experiences for our partners to streamline workflows, accelerate manual processes, and enhance patient care. Whether you're aiming to optimize care coordination, address critical social determinants of health, or simplify operations, our flexible suite of solutions adapts effortlessly to meet your unique challenges. Within our comprehensive technology suite, we have our Insights Growth product, which equips payers with actionable market and member insights, supports effective member acquisition, and facilitates the seamless management of whole person care. By integrating smoothly with your existing systems and processes, Unite Us ensures a scalable, sustainable approach to building healthy communities. If we go to the next slide, Ali. So for today, when we talk about that Insights Growth product, we're going to focus on market dynamics and benefit trends. Then we're going to look at retention and switching behaviors, learnings from 2025 tactics, and then we're going to look ahead, and then we'll leave some time for that Q&A. And as I mentioned, to start the webinar, please submit questions you have through the Q&A feature on Zoom. So with that, I'm going to jump into the market dynamics and benefit trends we saw this year. So one of the things we're seeing in the MA space, and if we're looking at non-SNP, non-EGWP Advantage plans, excluding the plan types noted in the bottom of the slide, we're seeing overall over the last 5 years a deceleration in the number of Medicare Advantage plan offerings. You can see on the graph on this slide, we've gone from 8% growth from 2021 to 2022 to actually negative 5% growth from 2024 to 2025. So the first time really we've seen negative plan growth. It was an overall 5% decrease. And so moving to the next slide, that coincides with general trends in the number of enrollees. So if we're looking at this slide, we can see over the last 5 years, December in the light blue, January in the orange. This is the Medicare Advantage enrollment and the growth rates year over year. We can see looking at the number of plans, now looking at the member enrollments, that the same patterns are emerging, and we're seeing lower growth rates overall with just a 0.6% growth rate this year. Next slide. How does this then break out amongst regional and national plans for AEP? There's definitely been a big shift in the enrollment trends, with regional plans growing this year at 8% during AEP compared to just 1% with that for national plans. This is actually the second year in a row that regional plans have outgrown national plans, and there's some strategy, I think, on the national side and some other factors at play, but overall, it's been a very good couple of AEP periods for regional plans and being able to achieve optimal enrollment growth and being able to compete against the national players. One of the things is we've seen more plan exit, which we'll highlight here. We've just seen different growth trends over the past couple of years. When we look at now where those exits and entrances are happening across the country, more about 80% of states saw more plan exits than entrants this year, and Vermont and North Dakota were the two states with the highest ratio of exits to entrants this year. A couple other things to just note of interest: the Northeast and West have a ratio of exits to entrants almost 50% higher than the South and Midwest, really mirroring some of the demographic and population shifts in our country. And so we can kind of see where competition is increasing and where it's decreasing throughout the country. Next slide. One of the ways this is reflected is in the growth rates for both national players and regional players during AEP. On the national player side, in terms of overall gross enrollments, United Healthcare led the way, though this just was reflected in an overall 3% growth rate. If we're looking at the percentage growth, and the Anthem Health Keepers plan had the largest percentage of growth. On the regional side, a number of Midwest health plans saw the highest overall growth in AEP, led by Medical Mutual of Ohio, closely followed by UCare. And then on the percentage side, we can see Wellmark Advantage Health Plan had the highest overall growth rate of those top 5 plans. So it's definitely mirroring some of those exits and entrances. We know based on what some of those national players did, pulling out of certain markets or offering less competitive plans in those markets, that some of the Midwest and plans operating where we saw higher amounts of exits were able to take advantage and grow at higher rates compared to some of the other areas that national players stayed in and were competing more aggressively for new enrollments. If we move to the next slide. So what drove the success? What are some of the features of these health plans that saw high growth versus low growth? We can see, starting with monthly premiums, high growth plans had a $10 monthly premium compared to low growth plans who had a $17 premium on average. RX deductibles were also lower for the high growth plans, and they tended to offer at a much higher percentage rates the over-the-counter benefit and transportation benefits. So this continues to show that you need to make the right smart investments with your benefits and your premium offerings in order to compete in the market. If we go to this slide, we also know that in conjunction with all of the um, changing enrollment behaviors, slower growth rates in the terms of MA enrollments, in the terms of number of plans offering, there's also been a decrease in star ratings from a high of 4.33 in 2022 to now um, or a star rating of 3.9 in 2025. The impact of this is a majority of enrollees will be in plans that experience a drop in star ratings this year. And this really is going to cause pressure on health plans because it will also impact their top line revenues. So as they're acquiring members, their revenue per member is dropping because their star ratings are going down. And then we know that there's some MLR trends and costs going up. And so this is really squeezing health plans and creating some of the situations which Ali will dive in further later in the webinar. One of the things we've looked at is the premium rates weighted by enrollment over the past 5 years, and we can see a pretty solid trend down from $20 in 2021 to $13 in 2025, though it's relatively flattened out over the last 3 years. As we look and know, consumers with inflation and everything going on are very sensitive to the initial sticker price that they see, holding the premiums down, and health plans focusing on that has been a key factor in maintaining market share and attracting new enrollees. And we can see some of this reflected in health plan deductibles as well. And one of the kind of the byproducts of the Inflation Reduction Act is that they've actually gone up because of the caps on certain pharmaceuticals and drugs that health plans have had to recoup those costs in other ways. And so they've done that by raising the drug deductible and health deductible to make sure that they can balance their books. And so while lowering the front end costs on some of these things, it has the potential for certain consumers to be more costly to them on the back end with should they use certain benefits or max out certain deductibles. So that's one of the shifts in the market, and depending on the individual consumer, individual enrollee, they'll have very different experiences with this kind of rebalancing in the market away from certain costs towards others. And I think we've got one more slide here, Ali, and then I'll turn it over to you. While the overall majority of MA plans still offer the most common benefits, we are seeing a significant decrease in less common supplemental benefits, which has been a change from the trends we've seen over the last few years, calling out over-the-counter benefits, transportation, meal benefits, and Part B rebates. Really, Part B rebates the exception here. I think, again, calling out health plans are dealing with a lot of challenges right now, and you need to find the dollars somewhere. You need to balance being able to grow and attract new members with retaining your own and managing their healthcare costs. And so plans are being very strategic. We know that some of the larger health plans, national players, also have additional pressure from public markets and such. And so they are more aggressively cutting costs either by exiting markets that are not performing to their standards or by cutting back on benefits. And so there's a lot of ways to do that. And one of the ways Ali will get into is how we can help manage and retain members for you so that you can focus on the managing costs, on attracting the right amount of members, and overall driving the success of your health plan. So with that, I'm going to pass it over to Ali to talk about retention and member engagement.
Perfect. Thanks a lot, Jens. So there's definitely a lot of disruption in this AEP as Jens went over some of the topics. Seeing more plan exits, seeing higher plan costs, seeing decreased benefits overall. And we're seeing a lot of that lead to more switching among seniors. So now is really the time to start investing more in your retention strategies and really to engage your members more intentionally. So over these next couple slides here, we're going to be covering some of the retention tactics. And starting with the first slide here is going to be covering the key drivers of switching that we're noticing. So we are seeing more of this switching activity across our book of business and also in the market overall. So going into this next AEP, here are some of the top things to address when thinking of switching rates. So the first factor that we hear consistently from seniors is that they're switching due to limited in-network access to doctors. Seniors are especially value keeping their PCP as they do tend to have longer term relationships with them. So losing their access to PCP will lead to that switching. These higher, plan exits did force a lot of seniors to switch to new plans this year. So they may be finding that their PCP is no longer covered. So this could lead to more switching, and we are expecting this trend to continue going forward. Another common reason for switching is lack of access to their lack of coverage for essential prescription drugs. The plan's formulary might have changed, so their drugs are no longer covered, or maybe they are covered, but just at higher costs, or maybe the plan now requires prior authorization, or their pharmacy might no longer be in network. So this could lead to more switching in the future as well. We're also seeing supplemental benefits play a major role as seniors have certain expectations when enrolling in a plan, but they're discovering that their benefits oftentimes just aren't enough for them. And then in terms of these benefits, what seniors really care about, it's going to be dental. This is one of the top things that we hear, vision, flex cards, OTC. So plans should really focus on these benefits and ensure that, the seniors are using them, ensure that the way they're advertised are, effective for seniors. And then finally, monthly plan premiums continue to be a factor. This is plan premiums and also just plan costs. They're being too high. And even as seniors are enrolling in $0 premium plans, they are often finding that, their their deductibles are just too high in the plan. Interesting, while analyzing our customer data, we did see that in most recent years, a lot more members left those low premium plans. It could be because, those plans have $0 premiums, but they also have higher costs associated. So it's definitely something to consider. And then finally, when looking at all these factors, there's just a lot more plan choices. So seniors, they're shopping more, there's a lot more options, there's more market penetration. So it's not, hard to find a new plan. So then going into this next slide here, with overall AEP growth slowing down over the previous couple years, switching activity increasing, as we mentioned previously, focusing on retention will really be the key here. So here's a couple tactics to maximize retention. So the first tactic is going to be to build confidence and trust among your members. And really doing this by establishing confidence, this will strengthen your engagement as well as your retention campaigns. Plans can do this in a variety of different ways, but really developing effective onboarding, benefits, education. It's important that, when a member joins your plan, they get that education right away. We do see that utilizers of supplemental benefits do tend to have more favorable views of their plan. So this could lead to higher retention rates as well as higher star ratings overall. So overall, just really good to ensure that the members are using their benefits. And then since plans are dealing with more, just MLR and profitability concerns, as Jen's mentioned, this could be a great way to boost, some of that financial performance as well. And then the second tactic is going to be to understand your members. And this is crucial as gaining insight into your member preferences as well as utilization habits really helps you customize your engagement. Some examples of this are, consistent outreach to members for things like their preventative screenings, their annual wellness visit reminders, chronic condition support, and as well as just general benefit utilization. So if, their OTC, for example, just letting them know, how much is left so they can use that benefit. And this outreach can also be in the form of, welcome messages or even birthday messages. So plans can really get creative with it and really engage their members that way. And then finally, it's increasingly important to understand, who will disenroll and why. So identifying some of these trends and common factors among disenrolling members to understand their reasons for leaving and where they're going. That'll help you, just develop more stronger retention strategies and engage with your members a little bit better. So then going into this next slide here. So we're going to be focusing here on how meaningful engagement after enrollment can drive long-term retention. And then also important to note that, once members are enrolled, the relationship doesn't stop there. It's really critical to continue to connect with them on an ongoing basis. And then just some things from our book of business here. So with the Unitas Insights Growth Tool, We do ingest customer membership data and we provide valuable insights and member engagement strategies. So here's a couple examples of way that our customers are using data to strengthen their retention campaigns. So the first one's going to be uncovering member insights. And plans can really gain a deeper understanding of their core members by using our member-specific predictive models, as well as our demographic data and detailed personas. So this can inform marketing strategies for your plans and can also provide insight into how to best engage with your current population for retention purposes. The second is going to be to highlight, membership trends. So we can do this by identifying switching and termination patterns within your organization, really to develop offerings that better meet your members and ultimately reduce churn. And then finally, plans can deploy retention strategies. And a lot of our customers, deploy these retention strategies to really develop meaningful member engagement campaigns. One of the things they do is they use our custom disenrollment models that are built off their actual disenroll members. So they can proactively engage with them and see, who's likely to terminate and then be able to, have some interventions there if they know that this type of member is more likely to terminate versus another type of member. All right. So then going into our next section here, we did conduct a senior research in early 2024, and it gave us a lot of insight into how seniors are thinking heading into AEP and what their plan choice drivers are. So excited to share some of the research and some of the findings with everyone here. All right, so on this first slide here, for our research, we did target thousands of Medicare-aged consumers, really to understand their behaviors, shopping habits, Medicare choice drivers. A lot of interesting takeaways here. So starting on this first slide, which is going to be looking at the plan preferences. So our research did find that having a PCP in-network was the most important factor for individuals selecting a Medicare plan. As we did cover in previous slides, seniors do value the ability to stay with their PCP. I think this is something that we're all familiar with. Seniors want to stay with their PCP, but just hearing it directly from the consumer survey, I think it was, just great to hear that as, you can look at your strategies and look at, your plans and see how your network coverage. So then the second most important factor was going to be low cost. And this is particularly for prescription drugs. I think notable to mention, as Jen's mentioned in previous slides, with the rising costs of drug deductibles and prescription medications over the year, this does continue to be a top topic for seniors as they're looking at different Medicare plans. And then interestingly, participants didn't really seem to value network flexibility as much. And this is interesting as we're looking at enrollment trends. We are seeing more of shift away from, PPO plans, more to HMO POS plans. So it seems like, those popular out-of-network plans might not be as popular anymore when seniors are, factoring what to choose for a plan. And then finally, lower income individuals did place higher value on lower costs and additional supplemental benefits. So really understanding your population, segmenting your population and knowing, who to target and knowing what type of individuals are in your population. So then you can, create plans that better meet their needs. And then on this next slide here, so when it comes to understanding Medicare, we did see that plan brochures and speaking to brokers were the top decision makers for consumers. However, we did see some really interesting specific trends among the different age groups when you're looking at the seniors, particularly 64-year-olds, the Asian population versus seniors who were on Medicare for several years. So that's 65 and older. So starting with the left-hand box here, the left box in the upper left corner, you can see that 30% of 64-year-olds, so those that are aging into Medicare, were unsure of the coverage they want or need. So this was no matter, regardless of their education level, which really shows that there's a clear gap in understanding of Medicare there. And then agents also prefer personal guidance when selecting a plan. They do prefer meetings, enjoying talking to family, friends, and brokers as well. So the Asian population really values that personalized touch. So if you are targeting that new to Medicare population, really important to have that personalized outreach for them. And then that said, on the right-hand side, for the older folks that have been through multiple annual enrollment periods, at this point, they are pretty comfortable doing their own research. We do find that seniors 65 and older do prefer printed materials and they do prefer researching online. So they're very, familiar with just going online, searching for plans. And our key takeaways here really for older population, direct mail can be highly effective in that switching campaign. However, for new to Medicare, it might not be as impactful for them. So for the younger seniors, using seminars, call centers, this can be a good strategy to really get that personalized touch for them. And then as far as media channels go, we did see that digital ads tended to be the most engaged with, and then followed very closely by email. And then in terms of social media use, it was notable, particularly for Facebook and YouTube. The younger seniors were most likely to be on social media. And then one really interesting thing that came out of this research as well was that newspapers remain very popular, and around 70% of the participants did say that they read the newspaper daily. So this can be a good tactic to target folks, whether it's print or digital. Newspapers are still, an untapped opportunity. So having ads there and really reaching to seniors that way. And then in terms of media, cable television did remain the most popular. And in fact, around 20% of participants said they don't use streaming services at all. So cable and newspapers, really, really popular there. And I think we'll get a lot of traction with seniors. All right, so then going into this next slide, what did we actually see our customers doing this year? Interestingly, a lot of this does align with the research that we just shared. So I think just a lot of similar learnings here. But one of them is that, they're leaning into email and digital for marketing a lot more. It doesn't mean that, they're abandoning direct mail. They might still be using direct mail. It's still an important tactic, but we are seeing more movement towards email for the lower cost option and then digital for that very targeted approach. And then in terms of budgets, we did see more customers going with cost-efficient sales strategies this year, with more reliance on in-house outreach. So plans might be more tactical about how they're deploying and targeting. And then third, we are seeing, there's more of a focus on retention campaigns and also ensuring that plans are growing in a way that's sustainable. I think with, some of the slides that we shared earlier around the Medicare Advantage enrollment slowing down over the previous couple of years, it's really important to be, targeting, just increasing your retention campaigns, making sure that, members are staying. And, just important to note that it does cost less to retain your members versus acquiring new members. So it definitely will be a focus going into the future here. And then finally, the majority of our customers are doing new to Medicare outreach throughout the year. So even during the AEP season, they still continue to do new to Medicare outreach throughout the year. So really targeting these individuals. All right. And then, so in terms of, just insights growth customers, really excited to say that, they did have a great year, very proud of the work that we've been doing and the results. So just proud to share some of the results here. We did for a seventh year in a row, the majority of our customers outperformed their competition. So seeing a lot of great results in terms of AEP growth. Customers did have an average net growth of 3.18%, and around 77% of them outperformed their markets. And then we also did have a 2.7 times higher net growth than the national plans and 5.3 times higher than all plans. So seeing a lot of great results here. And customers are leveraging our predictive models, they're getting those custom lists and then reaching out to those individuals that are more likely to join their plans and more likely to stay on their plan. So, just having that personalized touch is really important here. And then looking ahead and sort of just wrapping everything up here, have just a couple more slides. So what we covered today, we reviewed the 2025 national benefit trends and changes. So just saw what's happening in the market with that disruption. As we mentioned, there's a lot of disruption, but this disruption does bring opportunity as well for those that, can capitalize on it. And then discuss some proven strategies for growing and retaining your membership and the importance of retention overall going into the future. And then provided actionable guidance to boost plan performance and support lasting health through comprehensive member engagement strategies. And then going into this last slide here. So here's a couple of our recommendations for 2025 and 2026 AEP as well. So the first one is going to be segment-based engagement. So really identifying and engaging with specific member segments to predict who's most likely to join your plan and stay on your plan. So segmenting your population, really understanding your audience, understanding the consumers, and then targeting that way. And then retention campaigns aligned with member journeys. So really enhancing engagement by aligning retention campaigns with care gap closures, benefit education, and seamless onboarding experience. As we mentioned, it's a whole process of when you bring in members and then, closing their gaps and making sure that they are, they're satisfied in your plan, they're utilizing your benefits, and they also have, a favorable view of your plan, which can lead to higher star ratings and, just overall more success for your plans. And then strategic new to Medicare approach. So implementing a year-round new to Medicare strategy to really drive that long-term success, as well as leveraging higher engagement, health conscious behaviors of newer members for sustained value. And finally, smart benefit investment. So analyzing utilization trends in your market, really to make that informed decision around where to invest or divest in plan benefits and types. So seeing your utilization and, seeing what are the benefits that really move the needle in your market and what do consumers want, and then investing in your benefits that way. So we went over a lot. We do have a couple, we have some time for QA as well as we wrap up. As we mentioned earlier, we will share these slides as well. We will share the recording. So I think we can open it up here.
Yeah, and Ali, a couple questions came in while you were speaking. I'll ask the first one to you. How can data analytics help plans design their plans in a way that helps them retain members? What are the benefits, member acquisition strategy, or other ways they can use data to make that happen?
Yeah, that's a great question. So one of the things, using the growth tool, something that our customers do tend to use year round is, just understanding where you are in terms of, the time of the year. So for example, April to June, everybody knows that's the plan filing season. So during that time, using our data to understand, who were the plans that grew during the previous AEP, what did they do differently? Looking at your benefits and comparing your plans to their plans, seeing which benefits really drive the needle, push the needle, and what consumers might be attracted to. So using data that way to identify those benefits and compare your plan to their plan. And then another thing, during July to October, which is going to be the sales season. So really leaning into our predictive models and, we can create our predictive models using customers' data. So looking at their actual membership and then showing them based on consumer data, who are the individuals that are more likely to join their plan and also stay on their plan. So if they reach out to those individuals, they can have, just higher conversion rates overall. So that's another tactic that, is a great thing that they can do. And then as well as, just retention campaigns. So looking at, their previously disenrolled members. So we can create custom models that show them, these individuals disenrolled from your plans. What do they have in common and how you can find similar individuals that are current members so you can reach out to them and, do some outreach to help them stay on your plan. So a lot of tactics there that we can use, data analytics to really strengthen your retention campaigns.
Thanks, Lily. And another question, are you seeing a shift in enrollment towards or away from any certain plan types? I think you kind of briefly touched on that during your slides, but anything you would note or dive deeper into?
Yeah, that's a great question. So we did see enrollment in PPO plans level this year. PPO plans do remain the most popular plan just because, more carriers are offering them. But we are seeing an interesting shift in enrollment sort of away from them, and more into the HMO POS plans. And this could be that, those PPO plans might be, more expensive for consumers. It could also be because we saw more plan exits this year and more of those PPO plans did go away. But we are seeing an interesting shift away from them onto the HMO POS plans. And looking at HMO plans, they are losing members, but interesting that what it's like in the next couple of years here, as those are the low options. And then in terms of the special needs plans, one of the really interesting things that we noticed this year is we are seeing CSNP, so the chronic condition plans, grow in membership. They did increase by around 26% this year, whereas dual plans are only increasing by around 8%. Dual plans do continue to have most of the membership, but there is a trend in that, growth in the CSNP. So two things to really look out there for the future.
Great, thank you. Another one that came in, and maybe I'll start by answering this one, and then Ali, you can add your thoughts as well. But it's how can plans maintain financial balance while also trying to grow? And I think that's one of the big challenges we're seeing in the market. There are, some MA plans that have had to close up completely. We're seeing a high number of exits, and so in really in the midst of all of that, plans still need to grow, maintain MLRs at a level where they're able to profitably operate their plans. And this can be pretty challenging, especially when, you have nationals that are maybe exiting markets where they're not profitable. They're looking at their least profitable markets and they're, releasing those members back into the enrollment pool and other plans are signing them up. That can put a lot of pressure on them. And so I think it really starts with that data-driven approach Ali talked about, making sure you're growing intentionally, you're focused on attracting the right members, offering the right plan benefits and plan design that'll be optimized for those members. That'll do two things. It'll help, retain those members in the long term and help them better, be engaged with your plan and be able to take advantage of the programs you have. That's probably the second piece of the equation, which expands more broadly into what Unitas does, is you need to have a plan to acquire the member, but then also how you're going to engage and manage their health moving forward, making sure that any of their chronic conditions or other disease management pieces are in play, medication adherence, things like that, but also that they're engaging in any other programs you offer around, addressing social determinants of health, facilitating access to any resources they may need in order to achieve their physical health. And in the long run, if you're able to retain those members and build that relationship over multiple years, you'll be able to, be rewarded with a more profitable member in a way. Their costs will be lower. They'll retain. You've got more data on them, so you understand who they are and how they like to be engaged. And without that, it can just be very challenging to understand where to even begin. And so Unite Us, we've got growth to help you acquire those members. We've also got other predictive analytics products to help you understand the social needs an individual may have and how they like to be engaged in their health and social health. And then we have our core platform offering, which allows you to connect those individuals to organizations in their communities that can help meet their social needs and help drive them towards better physical health. We see, cost reductions to the tune of $85 per member per month when they've been engaged in social care services. And we know that a lot can be done both to lower costs, but also improve star ratings, improve adherence if we're actively engaging a member where they're out both in their physical health and in their social health. And so I think it's super important to have a plan to just manage that member from start to finish. Ali, anything you'd add to that?
Yeah, I think you hit the nail on the head there, Chance. Really, one thing important to note is that payers need to recognize that their role is really evolving from utilization management to more care management. So, as Jen's mentioned, it's not enough to just acquire members. It's also important to make sure that, they're closing their care gaps, they're scheduling their annual wellness visits, their screenings, quality screenings are being completed, and then also managing those higher acuity patients, and closing their gaps and really taking advantage of that risk score there. So overall, if that is done right, then as Jen's mentioned, lead to higher revenue for your plan and just better MLR and profitability overall.
Okay, one last question that has come in, and then please, if you have any more, submit them. Um, they're just wondering how Unitas can help them, realize some of the things we've talked about. What tools do we have? How do we help them identify what opportunities exist to either address their, AEP strategy or even some of their member social needs or social care needs that exist. Any thoughts on that, Ali, or I can take that one as well.
Yeah, could you take that one and I could add as well.
Yep. So yeah, I mean, I think if you're wondering where to start, we have plenty of great team members that are willing to engage. We've worked with really a number of different health plans that have, data and analytics needs. They have platform needs for social care. They have the need to work with our proactive engagement team to reach their members. And so we're able to really meet with you and understand how we can plug in um, uh, how we can plug into what with where they're at in their journey of our, we have robust analytics, we don't, we want to start with the analytics, we want to start with the platform. We're able to kind of match that and then add on our capabilities as the resources and time allows in order to maximize that journey we talked about of acquiring the member, retaining them, and then making sure their physical and social health are maximized. Maybe Ali, you're more focused on the growth product. Do you want to just talk about how specifically we can engage and support with any plans or partners interested in learning more about the product and how it can fit into what they're trying to do?
Yep, exactly. Yeah, definitely. Depending on where you are in your life cycle, your Medicare life cycle, if you are focused on expanding to a new market, for example, we have a lot of great dashboards that show you that opportunity, really understand that market, understand the segments there, understand the opportunity there. Are there a lot of Medicare eligible folks? Are there a lot of folks, on national plans that might have exited? So we can help you really understand that market and understand what to do there. And then if you are, in the plan benefits phase and you want to, enhance your benefits, or you notice that, plans, you have a lot of great benefits, but consumers might not be joining your plan. So we can show you, what are these plans, the high growth plans doing to attract members? What are the benefits that are really moving the needle here? So we can help you understand that. And then as well as if you are in that growth life cycle and you are wanting to grow your plans, using our predictive models to really understand, the members or the consumers who are more likely to join your plan instead of, as opposed to just reaching out to the general population. We can help you with that predictive analytics piece to, help your engagements and help your outreach to prospects. So a lot of different ways there. And I think on this next slide here that we're going to be sharing as well, we do have a couple ways to connect with our team. If it's for a demo or for just learning more about our product. As Jen's mentioned, we do have a suite of products, whether it's growth, social connector, it can help you understand your risk of your population. So there's a lot of different tools here that we can use for your plans.
Thanks, Ali. That's all we had for questions today. Thank you everyone for joining us and for being part of this discussion. We hope you gain some valuable takeaways to refine your strategies and stay ahead of the curve for the next AEP season, which will happen before we all know it. If you're ready to apply these insights and optimize your approach for the next enrollment season, we encourage you to connect with us at Unite Us. Our team is here to help you navigate the evolving landscape and enhance member engagement for lasting success. Be on the lookout for the recording and additional resources in your inbox. We'll get that out as soon as we can. And thank you for your time today. We look forward to connecting with you in future sessions, and have a great day.
Thanks a lot, everyone.